and welcome to TruST TV. I'm Ruth Rogers from the communications team in the Southern Trust. And we are super excited this month because we're introducing a brand new service for our patients who need mental health support. And we've teamed up with colleagues in the East London Foundation Trust who run a similar service. And the clinical lead for that service, I'm really pleased to say, has joined us today, David Walter. David, hello, how are you?
Hi Ruth, thanks for having me today. Great, thank you. Great to be here to talk about Steps to Wellness.
So tell us all about this new service and how will it benefit patients in the Southern Trust?
Absolutely. So Steps to Wellness is an adult mental health service. So it's aimed at people who are 18 plus, and we're aiming to support people with what we call mild to moderate mental health difficulties. So this includes, but isn't limited to, things like depression, anxiety, post-traumatic stress disorder, obsessive compulsive disorder, panic, health anxieties, social anxieties, a real wide range of difficulties that people might experience. And what we aim to do with this service is to see people as quick as we can, to give them some really good interventions and strategies so that they can help themselves going forwards.
And sounds excellent. David, I'm wondering, during the past 2 years, we've seen a real significant rise in the number of patients coming forward needing mental health support. And I'm wondering, in your practice, are you seeing many problems at the moment that are linked either directly or indirectly to the pandemic?
It's interesting, Ruth, because I think over the years, there's been more and more discussion of mental health, and it's becoming slowly less and less stigmatized. And so thankfully, people are becoming that bit more confident in coming forwards and saying that they're struggling and needing support with anxiety and depression. However, with the pandemic, there's been nothing like that to really cause a huge amount of anxiety, depression, and grief over that period of time. And we know from studies that if we do less, and if we see less people, we're likely to feel more depressed and more low. And for a lot of us, we've been through so many challenges over the last few years with the pandemic, whether it's changes to ours or the health of those around us, whether it's loss or whether it's changes to work and financial and social differences. And with all of that in mind, we know that's going to have a huge, profound effect on people's well-being. We know that if people go out less and interact with others less, that's going to cause them to feel more depressed. And for many people, that's been enforced over the course of the pandemic. So it makes sense that there's going to be a huge amount of people who have struggled with not being able to see their loved ones, with not being able to do the activities that are helpful for them, and with generally feeling lower and more disconnected from people. And so what we hope with Steps to Wellness is that we can really assist people in building up more interventions and strategies to help themselves connect more with those around them and do more of the kind of things that are going to be really good for them. And that can be really simple things. It doesn't have to be something really massive and grand. It can be little things, like little bits of activities that might have dropped off the radar over the last few years or so.
And so will this service initially be aimed at patients who are maybe already on a waiting list, David?
Yes, so at first, what we really want to do is address the people who've been waiting for mental health services for some time. So we'll be looking at waiting lists and looking at who we can offer this service for initially, so that we can bring them in to these great interventions that we're going to have on offer. And once we've got a really good flow with that, and once we feel that we've been able to address that backlog of people waiting there, we really want to be doing what we can to support those in the community that also are really struggling with anxiety and depression at this time.
So David, you run a similar service to this in London and in other parts of England where it has been hugely successful. Why do you think it's been so well received by the patients who use this service?
I think the real benefit to it is that when people are struggling with anxiety and low mood, they want something that's going to help them quickly, and they don't really want to sit on a waiting list for months on end. And the real perk of these kind of services is that we draw people in very quickly and give them these interventions to help themselves. And people really like that. People want to be able to be equipped with the skills to help themselves and not to feel like they're being told what to do by a practitioner, for instance. And so I think the real great thing about these services is that it's about upskilling all of us so that we know how to best become our own therapists. And that means that when the sessions end, we can carry on helping ourselves and we can carry on making things better for ourselves and those around us.
So do you plan to use those similar approaches here in the service in the Southern Trust?
Absolutely, yes. So it's really about making sure that everyone that comes through to our services can be skilled up in those ways and can leave the intervention really feeling like they know the best ways to support themselves and to make sure they can do all the things that's going to make things better for themselves. And that's not an easy thing to do. A lot of us need a hand to hold and to be led sometimes to understand how we can feel better. But the end result of this is that we can carry on helping ourselves and continue those important steps going forwards.
There must have been a huge amount of planning, David, to replicate this service that you have in London and elsewhere and bring it over to Northern Ireland. Has it been a big team effort, or how has that gone?
It's been a huge team effort, and it's been a really heartening experience with working between Elft colleagues and Southern Health colleagues in how we could best put our minds together to make this work. So we know that these kind of services work really well in England under a structure called IAPT, which is improving access to psychological therapies. But we were really mindful coming into this project that we can't just land this IAPT notion exactly in Northern Ireland. There's going to need to be some reconfiguration taking place. So there's been a great deal of expertise on both sides coming together to work out the best ways to make this something that's going to be really beneficial to all of the communities that we have. So a huge amount of effort and a real lot of collaboration between managers, staff, service users. It's been such a brilliant experience to see everyone really just motivated and really keen to do something that's going to benefit our service users.
And we're really excited to see it starting. It commences later on this month, David. So what can our patients expect?
Yes, so we've got some groups kicking off later this month, which is fantastic. So we've got some great groups starting focusing on anxiety and depression. And then as the project continues, we'll be broadening those groups to different topics that we can bring for our service users. And I think the real great thing about this project is how we're going to be utilising working digitally for a lot of it too. And so I know for a lot of service users, there's often some concern about whether it's working digitally through a screen or even in a group format. And we know from the IAP services in England that this is a hugely beneficial approach. And oftentimes it's about having good conversations with our service users to help them understand what it's like being in a group setting and what it's like working digitally. And it's really fantastic, the feedback we get time and time again from people who are really apprehensive, perhaps about being in a group or doing it through a screen, who have said they're not too sure, but they'll give it a try, which is great. We often just want people to give it a try and see how it goes. And that they've said that it's been far better and far more beneficial than even one-to-one work they've had in the past. And often that's because you're hearing from other people who've had very similar experiences to yourself, rather than just hearing from one health professional. And so we know these group experiences can be hugely uplifting and beneficial for all. And whilst working digitally can be a little bit of a different concept for starters, we've got real great expertise with our clinicians working as part of this service who are able to make it a really just cohesive experience where everyone's working together in a really enjoyable way.
Oh, David, we wish you the very best of luck with it all. And thank you so much for taking the time to speak to us today.
That's great. Thank you, Ruth.